Hi everyone, my name is Crystal Asilio. I am a student at Touro University Worldwide. I'm in my last year of the Marriage and Family Therapy program, and this is for my capstone assignment. It's part of my class, MFT 690 Capstone. So for today, I will be talking about the theoretical model I've chosen for my capstone project, which is called narrative therapy. So, a little bit about narrative therapy. It was developed around the 1980s by Michael White and David Epson in Australia. And the reason why I chose this model is because it really resonates with me due to the fact that it focuses on emphasis on the idea that the person is not the problem and the problem is the problem. So, for example, the problem is treated more as a separate entity or an object, etc., which is something that both Michael White and David Epson emphasize heavily in this model. So, as a therapist in training within my practicum, this perspective feels very empowering and respectful to my clients' lived experiences. So, in my personal view, when it comes to change in the client, depending on what their presenting problem is, and initially the reason why they're in therapy is due to the fact that change happens when people are able to separate themselves from these dominant stories that they've been living in related to the problem that they're dealing with. So these problems are formed when stories of failure, shame, or trauma become dominant and limit to how people see themselves. When we open space for clients to explore new or forgotten parts of their stories, they can turn into something more richer and more hopeful as part of their identities. So there are three key interventions regarding that relates to narrative therapy, which helps create this change throughout them, which one of them includes external problems. So as I mentioned before, regarding separating the person from the problem, such as giving it a name or treating it as a separate identity. So as for example, I could ask a client if we could create a if we could give this problem a name, what would you like for it to be called? Or we could also ask them, for example, there's a client who has for example, actually, no, for example, if there's a client who has depression, they talk a lot about why they feel so depressed. I could even I could even say in the statement, so the depression is making you feel down lately, or the depression has caused you to have a lack of sleep. Deconstructing harmful stories, that's also another example, which includes tearing apart a much deeper meanings regarding practices regarding the client's culture, their background, their upbringing, regarding like societal factors. So that's also an example of that. Reauthoring preferred stories, which also is also called unique outcomes. So unique outcomes could be, for example, okay, when has there been a time where the problem has gone away? Or when has there been or can you tell me who else can support you during this reauthoring moment? So it gives a chance for the client to rewrite their own narrative that counters and challenges the dominant story that's affecting them as to why they are brought up in therapy. So in my paper, I was also asked to talk about how do I apply this model with with diverse clients, such as clients who are outside of my background. I'm Latina. I'm a second generation Hispanic American, and in my practice, I mainly work with majority clients who are Hispanic. Not that many of them are have been outside of my ethnicity. So in my paper, I talk a little bit about like how do I apply with not just with Latino clients, but also with African American clients. So in working with both of these clients, this this model is very culturally sensitive due to the fact that not only is it collaborative, but the therapists, their role is that they maintain a non-judgmental stance and they mainly provide a more empathetic and an active listening role due to the fact that they're more curious about getting to know the client, getting understanding where they're coming from, and do their does their racial or cultural identity actually affect affect the problem? Are they part of the problem? That's also something to like dig up on. And it also respects their family background, their community, and their traditions, while also helping them craft stories that reflect both resilience and growth, which even across generations. And I also talk about how do I apply this model with children and teens, due to the fact that I also have experience applying this model with my younger clients at my practicum, which I do have a lot of fun with because it's very naturally playful and very flexible. So, and I find this to be more integrating with creative interventions such as play or art therapy and using a lot of, especially your young clients, because they tend to have very imaginative, playful minds, as I like to say. So compared to an adult where you can explore more about the problem, with children, you have and adolescents, you kind of have to match their language, especially with young children, due to the fact that they need a more clear understanding on how they express themselves openly. So applying storytelling can be a form of narrative therapy, and it could be used in a creative way. So, for example, I have a 9-year-old client who I was seeing often, and his parents referred him to therapy because he due to attitude problems in the home, and the parents were a bit confused due to the fact that he exhibits different a more different attitude outside of the home. He is, according to his school faculty and extended family members, he actually is very polite and respectful compared to how he is at home, where he's where he's apparently exhibits rude behavior and is defiant towards his parents when it comes to pick up after himself. And when we start to do a lot of storytelling, he talks a lot about anger. The anger consumes him sometimes whenever his parents tell the anger what he should or shouldn't do, and that's when the anger comes out. And also he mentions a lot about being frustrated due to the fact that he is the oldest of two toddler brothers who are both 12, I mean, not 12. They're both 2 and 3 years old. And he mentions a lot about that the frustration causes him to want to separate himself from his family by staying in his room all day whenever he comes home from school. So regarding narrative therapy, a lot of young clients, they respond really very well to metaphors, drawing, storytelling, and naming the problem. So for example, they're very creative when it comes to naming the problem. So it could be if it relates to anxiety, their problem, it could be called the worry monster or the scary monster if it's about fear or trauma even, because it gives them more agency. It gives them autonomy to actually be in control of their story. And I also talk a little bit about clients of to add apply this model with clients who have eating disorders, as mentioned by Alice Morgan in What is Narrative Therapy, an easy to read introduction, where she talks a little bit about her experience with working with clients that exhibit eating disorders. She mentions that they also It also helps them in separating themselves from the eating disorder, treating the eating disorder as its own separate entity by calling it, for example, the monster, externalizing itself, which also prevents them from from a lot of self-blame and feeling less guilty. So, which is pretty powerful in my opinion, because rather than blaming themselves, they see the disorder as more of an external influence and they reclaim their relationship with food, body, and themselves. So I did add a case example at my on my paper. So I used one that was like based off of a recent client of mine at my practicum, which one example, it's a 16-year-old client. So she came to therapy um due to struggling with a recent breakup of a long-term relationship, and she struggled with setting emotional boundaries due to the fact that she and her ex-boyfriend go to a very small school where they go to the same classes on one floor, and she struggles to set these boundaries and and to allow her to heal. And by externalizing these labels, because she mentions a lot about being about that she feels that she's the problem and everything, that she's not able to find love through others. And we focus on a lot of affirmations, but also mixing narrative therapy by whenever I ask her, okay, what does the breakup say? What has the breakup taught you from these past experiences with your ex-boyfriend? And she mentions about it taught her to like open her eyes and come to a realization that she and her ex weren't perfect for each other, and she starts to recognize a lot of these flaws that were going on in the relationship, such as her being cheated on multiple times, and however while she was aware of that, she decided to take him back due to the fact that she wanted to she wanted to continue being accepted, she wanted to still feel love. So we worked on trying to find ways to like regain her identity, separating herself from that breakup, which it's pretty powerful because it wasn't about fixing her, it was about expanding who she knew she could be as a human being. So to close things off, narrative therapy, it definitely fits who I am as a developing clinician because I'm a storyteller. I love telling people that, we all have a different story path. We all follow a different lives, and we separate ourselves from that. And regarding narrative therapy, I do love the fact that it's non-judgmental, and the client, they're seen as the expert in their lives. They are the author of their stories. They're able to disregard the dominant story and using new pages to rewrite it into something that's more hopeful, that's more positive, that's more con that's more resilient, in which it gives them the opportunity to find eh, find past or future positive experiences through that. And it's also very collaborative, which I really love because I do see myself as more of a collaborative therapist because I'm not all about, being directive and telling a client what they should or shouldn't do. I'm just all about whenever I start a session with a new client, I always ask them, what are the three goals that you want to work on? We're gonna start with three, and we're gonna work on the one that you want to work on the most, the one that's affecting you, the one that's affecting you the most in your life. And I want to feel that they are the expert, my clients, and that model gives me a framework to continue supporting that journey. So thank you so much for listening. Have a good night, y'all.